So viewers, we have Sandra and Jordan with us, and they're going to show us around the ambulance and the equipment fitted in. So Sandra, show us what this vehicle is all about, and what have you got in it?
All right, so this is our ambulance that we would take to any emergency call, and I'll show you the front first off.
Is this a particular type of an ambulance, or what do you call it, standard ambulance?
It's a standard ambulance. You can either have a primary care crew or an advanced care crew on one of these ambulances. They're 24 hours, most of them. Inside, what you can see is our computer that we use for our mapping system.
Okay.
As well as we have a radio in there that we talk straight to dispatch with.
Okay.
So when we get a call, what we would do is they would first tone us off in the base, and then when we come into the vehicle, they would give us the call information over the radio.
Okay.
And then we can type the address in there, look it up. So generally what you have is one person is the driver and one person is attending on a call.
Okay.
So the driver may get the information, the attendant will probably look it up for you and then direct you into the call. So they'll kind of navigate you. So inside here is just it's another equipment. This is what we call our scoop stretcher, so we would use this anytime that we're needing to extricate someone, where possibly we're suspecting a spinal injury and we can't get a spinal board, a flat board underneath them.
Okay.
And this would be if we're suspecting a spinal injury and we're not able to, if the person's in a sitting position, for example in a car. This one is a Sager splint, so this we would use on leg fractures. And this is a pole stretcher. This is just a piece of canvas. It's like an old-fashioned stretcher. Very useful in areas that you can't get a stretcher in or that you have to carry a patient out. This is our portable oxygen. Okay, and I'll show you what the adapters we put on it. So we're entering the back of the ambulance here. We just have a couple of places where people can sit. If we have some extra people or a firefighter or something along, they may sit here. This just folds down and has a seat belt.
Okay.
Okay, and then this is a seat where generally the paramedic would sit and be strapped in.
You can sit down and
okay.
explain.
There or where Jordan is if you are doing some stuff with the patient. Over here we've got a couple of things. We've got controls for the lights.
Gordon, tell us what do you have in this bag?
So this here is our airway bag, and what we have here is, so to start with, here are some oropharyngeal airways, and we use these to protect the airway in an unconscious patient or a patient in cardiac arrest. This is our initial step to keep the tongue off of the back of the throat. And then again, everything airway is in here. So right now we have, this is the bag that would come into the residence with us. So in here we have suction in case there's anything in that airway that we need to suction out.
Do you want to demonstrate? Okay, I can get
We'll
that.
get you onto the stretcher here and then we'll hook you up.
All right.
So we've talked about airway and breathing, and we just mentioned circulation. What I'm going to show you now is our cardiac monitor, which is a LifePak 12, that we're going to, I'm going to hook him up to the monitor, put some electrodes on his chest, and look at what his heart rate is. I can check his blood pressure, check how much oxygen is transporting through his blood. So I can do this. I can do a 12-lead ECG, similar to what they would do in the hospital. So we have an idea if somebody's suffering from chest pain, possibly having a heart attack. It's one of our diagnostic tools that we use for assessment.
And whatever is coming on this monitor, my vital signs, let's say the blood pressure, are you able to transfer this information to the hospital so that they are aware of what's the condition of the patient?
Yes, in certain situations, if it's something, if there's some stuff that's showing on the monitor that would lead us to want to take them into our cardiac unit, we can use, it's a Bluetooth technology, we can send it right to the cardiologist, and so they'll have they'll have an imprint of it right as soon as we get there.
And you can also talk to the specialist on the phone?
Yes,
and you get
yes,
instruction?
yes, exactly. Okay. So through the cath lab.